There is growing concern about a lack of common pain relievers for children. Pharmacies are dealing with a nationwide shortage.
This is normally where we would keep our Tylenol suspensions for kids. All we have left is one pack of suppositories.
Manufacturers say the shortages are the result of higher than normal demand and supply chain issues. The shortage prompted the Hospital for Sick Children in Toronto to recommend that parents get a prescription for liquid Tylenol and Advil in order to make sure that their children have access to the drugs. Meanwhile, Health Canada says no prescription is needed for over-the-counter drugs and urged the public not to stockpile the medications. Dr. Dina Kulik is a pediatrician and the founder and director of Kid Crew Pediatrics in Toronto. Dr. Kulik, thank you so much for joining us.
You're welcome.
Dr. Kulik, how bad is the shortage that we're seeing across the country?
It is certainly causing a lot of panic amongst many families that I've spoken to recently. It seems that after that announcement earlier last week, many people went out a bit panicked, looking to make sure that they could stock some of these medications for themselves if their child was sick, or if they were worried their kid might become sick in the coming weeks or months.
And is there reason to panic? Is there reason to stockpile? What's your assessment?
I hope that no one does stockpile. We don't want to go back into a situation like at the beginning of the pandemic when people were stockpiling toilet paper and we couldn't find toilet paper. We only want to be taking as much medicine as you need now for a child's illness now. I really encourage people to not stockpile because that means that other people, other parents, other children won't have the medications that will make them feel more comfortable if they're sick.
And what do you make of the idea that perhaps parents should be getting prescriptions for these pain relief medications for their children?
It doesn't seem that the prescription scenario is very helpful. If the medicines are not available at the pharmacy, giving a prescription doesn't suddenly make it available. The one benefit of a prescription is if the pharmacist is keeping some back stock and is dosing these medicines out in smaller doses, so taking a bigger bottle and making it into several different doses for multiple families, that can be helpful. But as I understand it, many pharmacies don't have any supply at all, and providing a prescription doesn't make that situation any different.
So if parents can't find these over-the-counter medications for their children, what should they do?
It really depends on your child, on their age, and whether they're able to take other medications. Many pharmacies still have chewables available or the older kid and older adult version of medications. Certainly, you don't want to be giving a baby a pill of ibuprofen that an adult would take. But if your child is a bit older, if they're able to swallow medication, that is an option. I always recommend, though, to touch base with your healthcare provider to make sure that other options for medication are safe for the child based on their weight, based on their health status. Always touch base with your healthcare provider to find out that information.
And as a physician, what's your biggest concern?
I am worried that kids won't have access to medication when they're sick that can help make them feel better and decrease their fever. Now, importantly, fever isn't dangerous in itself. That's a myth. Many families believe that fever, if you don't treat it, will cause harm. That isn't the case. But certainly fever is uncomfortable. Kids don't feel great when they have a fever, so we do want to decrease it to keep them comfortable. And honestly, I'm much more worried about the stockpiling of these medications, leaving less accessibility to other kids that need in the moment.
Okay, Dr. Dina Kulik, a pediatrician in Toronto. Thank you so much for your time.